Hello, this is Palmdale City Manager JJ Murphy. To say that 2020 has been a long and difficult year would be an understatement. By now, we're all getting tired of having our lives disrupted by COVID-19. Many people in our community have had friends and family members impacted by this disease. I personally have lost a cousin recently to COVID, so this has really hit home. And we all have to do our part to stay focused and committed to safety. With the current spike in case numbers, it is more important than ever that we stay vigilant in our fight against COVID. To give us a perspective from our medical field, we reached out to Dr. David Bronstein of Kaiser Permanente for some thoughts and information that I know you'll find very helpful.
When it comes to COVID right now, the reality is we all know what we're supposed to be doing. It's just very hard to do it, especially after so long, and we're all tired and we're fatigued from having to do this for so many months. But we really do know what it works when it comes to preventing infection. And all the things that we should be doing on a daily basis, they absolutely do work. We just have to do it and do it consistently and do it well. So wearing a mask, I would say, anytime you're in public, anytime you're around someone who's not part of your immediate family, part of your bubble, if you will, absolutely essential. Masks have been shown to work. They work extremely well in preventing transmission of the virus, and they really need to be worn, and worn correctly too. There's nothing more frustrating as a physician than seeing somebody who has the mask under their nose, below their chin, anywhere other than covering your mouth, covering your nose, which is where the virus is going to try and go in. And wearing a mask of any sort, whether it is a surgical mask, a procedural mask, or a cloth mask, even those neck gaiters, which I know got a bad rap initially, those are fine too. Ideally, you do want a few layers there, but any mask really will do the job of preventing the virus from infecting you very, very efficiently. It doesn't just protect the person who you're with, it also protects the person who's wearing it as well. So wearing a mask is essential. Distance is key. I know we always talk about 6 feet of distancing, and that's important when you think of how the virus is spread by respiratory droplets. 6 feet really is a distance that should keep you relatively safe. But remember, there's nothing magical about 6 feet. So if you're in a room with very poor ventilation and you're there with people who don't have their masks on, even if you are 6 feet away, if people are talking loudly or shouting or screaming or singing for that matter, they can still spread the virus fairly efficiently even farther than 6 feet. Even if the virus isn't necessarily spreading airborne, although there is evidence that it may be doing that as well, you can still spread it fairly long distances. Washing hands is very important. Cleaning surfaces is very important. Probably not as important as we thought it was before in terms of how the virus is spread. The virus really is spread more through the air, through the respiratory droplets. But even so, if someone who is sick with COVID coughs on the doorknob and then you touch it and then you touch yourself, your mouth, your nose, that is a way that the virus could be spread. One other thing, safety-wise, that I would really suggest this year is also getting the flu vaccine. You know, I know we're all focusing and concentrating and worried about COVID right now, and we very well should be. And the reality is all these precautions we're doing should also help with the flu too. The problem is, even though we're doing all these precautions, we still see skyrocketing cases of COVID right now. And so it's no guarantee that it's going to obviously prevent COVID, although it is the best thing we can do right now. The last thing we need while we're trying to keep people safe and healthy and out of the hospital, and we're trying to preserve the hospital beds for people who need it, because there's not a lot else we can do for COVID at this point if someone has a severe case. So I know everybody's very concerned and stressed right now about the stay-at-home orders and the fact that we have stricter regulations now than we really ever have since the beginning of the pandemic. And it's for an important reason. We have to preserve our healthcare capacity. Right now we have higher numbers of people in the hospital throughout the country, especially throughout California. And if we do nothing and we keep doing what we did over Thanksgiving break, and we keep traveling and spreading the illness and going to gatherings the way we have been and letting our guard down, unfortunately, we will exceed the capacity that we have in our hospitals, and we won't have anywhere to care for these people, and we'll have to be making some very, very tough, challenging, and awful decisions. This is really an emergency point right now. I wish I could tell you that, hey, the vaccine's coming out right now, so that's going to cure everything. It will be months and months and months before everybody's vaccinated at the level we need them to be at. I know we're all eager to be able to travel again. We're all eager to be able to attend parties again, especially with the holidays here. Unfortunately, this is not the year to do that. We can't risk it. It's not just about us and keeping ourselves safe. It's about who will we get sick if we come down with COVID without knowing it and spread it to those who are the most vulnerable. And unfortunately right now, since we're still in that time before the vast majority of us have received vaccine, we absolutely need to make sure that we're keeping the people we care about, the people that we love, as safe as possible. So we need to make sure that even though it's going to be a different Christmas this year or a different holiday, it's just vitally important that we follow the recommendations from the public health folks and not travel, not have large gatherings, and really be as safe as we can possibly be right now.
Thank you, Dr. Bronstein. We appreciate your expertise and advice. In closing, we're 1 week into the stay-at-home orders for the state, and we're close to seeing a vaccine being available. This gives us hope that life will be back to normal again. Until then, please join me in doing what we can to stop the spread of COVID. Let's all keep wearing our masks, staying safe distances from one another, avoiding large crowds, rethinking holiday travel plans, and only going out for essential services. Your sacrifices are truly making a difference for our frontline healthcare workers and first responders who are doing their jobs to protect all of us. We are grateful for your cooperation, and remember, Palmdale cares about you.